As the nation's hospitals and health systems continue to battle the ongoing public health emergency, now, more than ever, we must harness the collective power of our communities to champion changes that will advance health for every individual. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. The Foster McGaw Prize recognizes hospitals and health systems that are leading the way through innovative collaborations that improve the health and well-being of everyone in their communities. While we were not able to present the prize last year due to the pandemic, the AHA is honored to bring you this podcast series to share the stories of our most recent recipients. Our moderator is Janet Porter, a member of the Foster McGaw Prize Committee. Today, she'll guide a discussion on how Foster McGaw finalist Freeman Health engaged with community members, both young and old, to meet the needs of all those served.
Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Janet Porter, and I've been pleased to be a member of the Foster McGaw Prize for almost 20 years. Today, I'm really pleased to welcome Paula Baker, the Chief Executive Officer, and Janae Kennedy, the Chief Nursing Officer from Freeman Health System in Joplin, Missouri. And they're going to be discussing how Freeman Health has worked to promote health and made them deserving of receiving the Foster McGaw Finalist Prize Award this year. First of all, congratulations, both of you, on being a finalist for the Foster McGaw Prize. It's really quite an honor to be recognized for such an outstanding commitment to improving the health in your communities. So, Paula, I think it'd be great if you would first provide a brief overview of the Freeman Health System and the communities you serve.
Yes, I'd be happy to do that. Freeman Health System is located right in the southwest corner of Missouri. So we're right on the border with Kansas, Oklahoma, and Arkansas. And as such, we are a tertiary care referral for many rural areas throughout the region. We have really four components. We have Freeman West, which is our main facility, Freeman East. We have a critical access hospital in Neosho, Missouri, and we have a behavioral health division called Ozark Center. We have roughly 5,000 employees with over 300 physicians that we work with.
So, Paula, for many hospitals, there is a sentinel event, a report, a board retreat that serves as an epiphany where the hospital or health system realizes that their mission is really improving community health rather than just delivery of medical care. Was there a sentinel event like that at Freeman Health that really changed your perspective about your role as a 100-year-old hospital?
I don't know if there was one specific one, but there's certainly been a pattern. The demographics of our area are very interesting. We lag behind national averages in terms of level of education and income, and we have a disproportionately high amount of poverty. In our area, we are riddled with a lot of methamphetamine abuse, as well as suicides, behavioral health issues, cancer, diabetes, heart disease, and all of these demographics and these social determinants really drive us in that pursuit of quality outcomes for the residents of our area every single day.
Yes, and I'm so excited that you're going to be sharing some of the really unique programs you've developed to meet community need. But with so much community need, as you just articulated, and I think many people listening today will actually relate to the health problems you've identified, can you please describe how Freeman Health decides to focus their efforts? I mean, how do you really establish priorities?
Yes, well, we participate in a community needs assessment on a regular basis. So we look at what are the needs in our community, the most pressing ones, which ones are being met adequately, which ones there's a void, and which ones really services are non-existent. And seeing the non-existent or the very few services have really driven us to develop many of the programs that were in our application.
And Freeman Health has had such an impact because they've engaged so many partners in designing and delivering the programs we're going to be talking about today. So talk about how you reach out and partner with people and what you've learned from developing such powerful partnerships in your community.
Well, we've learned that collaboration is key. When we all work together for common goals, it's amazing what can be accomplished. So depending on what the need is, we partner with many other organizations throughout our region that have a similar mission. So if we're talking about providing health care to those individuals who frequently don't access it just because of the lack of resources, that would be an example where we would partner with community clinic, with our local federally qualified health clinic, and other organizations. When we were looking at our autism center and the development of that, we looked at the developmental disability organizations in our area, what they brought to the table, what they were interested in expanding, and how we might work together. So really for any service line or new program, we look at all the partners that are out in our region and try to join with them to strengthen our joint efforts.
You know, partnering and collaboration are not something that comes naturally to everyone, especially if they've been dominant in the healthcare community. And so what advice would you give to people who are thinking about engaging partnerships to have really community-wide impact?
I would heartily recommend partnering. We can do a lot more together than we can do individually. The patients are the ultimate winners in that, our community, and meeting the needs of that community. One organization can't do everything, but when we all join together and bring our resources to the table and our collective minds and resources, it's amazing what we can accomplish. So I would encourage everybody, collaborate with those partners out there, develop those relationships, and see what can be done to improve your community.
Let's talk about some of the really special programs that you've developed to meet needs in your community. So one of Freeman Health's priorities has been investing in children, teens, and young adults. Start by talking a little bit about the PATH housing and the Turnaround Ranch.
Oh, great. Okay, well, PATH is for pre-adult transitional housing. So there are a lot of kids in the foster care program, and they age out when they turn 18. So oftentimes these kids have absolutely nowhere to go. They don't have family, they don't have a support system, so suddenly they're just out there on their own. We know that annually there are about 25,000 young people who graduate from the foster care system. And we know that as a result of that lack of social support, at least 25% of them will end up homeless. So in our PATH program, we provide housing, supervision, counsel, advice, sort of like surrogate parents, to help these young people learn those critical life skills that they're going to need to be successful. So when they first come to us, they don't have a job. We provide at no charge all their housing, their living expenses. We help them get a job and become independent. Then they're still allowed to live there until they're 25 or want to move out, but they pay part of their expenses on a sliding scale basis. So this program allows them to develop the independence, but to learn those valuable life skills that most of them did not have the luxury of learning at home. And most of us learn that gradually over our growing up years, but many of these young people did not have that exposure or that environment where those important skills were learned. So we step in.
And that is a need that is represented in communities all across the United States, the aged out of foster care. So let's talk about the Turnaround Ranch.
All right. Well, the Turnaround Ranch, we have operated since 1981, and it is a residential treatment center for behaviorally disordered youth and adolescents. It's on-campus living. We have 4 cottages on campus, and then we have a transitional cottage for kids who are getting ready to graduate to a higher level of functioning. We have an on-campus school, a gymnasium, and a number of other buildings designed to meet their needs. This is a very intensive milieu where they receive counseling, therapy, and medication if needed, the whole goal being to help them through their mental illness or their behavioral disability. Oftentimes, these children have endured great hardships in their life. Many of them have endured physical, sexual, and emotional abuse and neglect. So they come to us with a lot of hurt, a lot of history, a lot of baggage. and we work really hard to successfully navigate them through these issues and help them to come out stronger on the other side. And we've had many, many successful graduates over the years.
How many children at one time are you able to manage on Turnaround Ranch?
In the Turnaround Ranch, a campus specifically, we can have up to about 70 at any given time.
Wow, that is incredible. And I was really surprised to learn that your average length of stay is 9 months.
9 months, that's correct. It takes a while. The issues that these young people are facing build up through many years. But I am always amazed by the resilience of these young people and the power of having consistent support in their lives, a secure environment, and just compassion, which those are things that many of these children and young people have never really experienced on any sort of consistent level. So it really is amazing to see what they're capable of doing. And we have many of them that come back to us later in life after graduation to show us how well they're doing, and they're very, very proud of that.
So another way that you've invested in teens is through the Student Volunteers Investment Program. So would you talk a little bit about that program and the impact it's had?
Yes, that's a really fun one. We do this with high school students and college students, and they come to us and they spend 8 weeks with us, and they're assigned to a particular unit in the hospital. They come to work to volunteer 5 days a week for 4-hour shifts. And they might be assigned to a nurse or a nurse tech, any number of individuals like that. And they're taught some very basic skills, how to take vitals, how to answer call lights. But really what it does is acquaints them with the healthcare profession, lets them see what it's like. You might think you know, but until you really get there in the trenches and have that experience, you don't know for sure. And we've had so many young people that have had that experience, that have at that time said, I'm going to go on and be a healthcare professional, whether that be a doctor, a nurse, a technologist, whatever that might be, they're really drawn to the field. So it's an excellent way for them to get their feet wet and see what healthcare is all about.
You know, I loved from your application, Paula, that you said most of all this program helps the students learn what it's really like to work in the hospital.
Janae, I don't know if you want to comment on that, but feel free to if you'd like to add a comment.
Yeah, sure. We love working with the students from the high schools and feel like it's a really great opportunity for them to come in and get acquainted with the hospital, to grow a passion for healthcare and patient care. A lot of times they learn what they want to do if they're on the fence about what career path they want to take, whether that be nurse or doctor or technician. Like Paula said, they're able to really mold that into what they decide that they want to do. And our nurses and physicians are really proud to get to work with them and partner with them. So it's a really great program that we love participating in.
We have a waiting list almost every year because it's become very well known throughout the region, and people will call in months ahead to get enrolled in it. So that's really nice that it has gained such momentum.
So Paula and Janae, let's go to the other end of the spectrum, age spectrum, that is. So Freeman Health also has a very innovative program that they provide for seniors. I think it's 50 plus. And that program is called Freeman Advantage. That mature program, which was established 22 years ago, is really a model for how hospitals could make a difference in the lives of seniors.
Freeman Advantage is a really wonderful program. It not only provides an opportunity to educate the members with health-related information, we can do screenings on them, we can help them be mindful of all the preventative medicine measures they need to be putting in place. We can help them if they need some higher level of care, such as a surgery or treatments. So it really helps us connect with them at the time in life when they might need us the most. Also, it provides a very valuable social connection. We know the effects of isolation on individuals, and it's not positive. So having this opportunity for them to gather during a time that they're being educated and they're learning wellness techniques and measures, but also having a very valuable social interaction has been wonderful. We've had a lot of individuals who have recently been widowed or become widows, and they join this group, and they find that companionship, they find that social aspect that really helps with that grief process and with the alienation that they feel. So we really think it checks those two very, very important boxes all at the same time. They do a lot of trips just around the area, and then they also have the opportunity to go on some international trips as a group. And when they get older, some people don't feel safe traveling on their own, so they can go on these organized trips where we have our staff leading it and helping take care of all the arrangements, where they can just enjoy a trip to Ireland or wherever it might be.
So another model program that I want to mention while we still have time is the Bill and Virginia Leffen Center for Autism. So would you talk a little bit about that?
Yes, it's what I love to talk about the most. We had opened in 2007, and it came about when a mother and father came to my office and said to me, our son has autism, Dad has to stay here and work, and Mom and son had to travel to Cleveland, Ohio, so that he could be enrolled in the programming, and so the family was split up. They said to me, well, why don't we have anything here for autism? And that question echoed over and over and over in my head. And so that was the catalyst for the beginning of the program. We were able to secure state funding, and we were able to put together a program starting out with just a daycare program, because we know that's when the window for the efficacy of treatment of autism is the greatest. And then in subsequent years, we have added a secondary classroom, in-home services, services for older adults living on the spectrum, and we see miracles in that program every single week. We have heard 5- and 6-year-olds say their very first word ever. We have seen kids give their parents the first ever hug, and we have seen them go from totally non-responsive to talking very, very well and being able to communicate their needs. It's like something changes in that brain of that child, and all of a sudden those puzzle pieces fit together. So it has been a remarkable program, full of miracles, full of hope for these children and their families. We're very, very proud of that.
So, Paula, we have only been able to highlight 5 of your many programs that are making a difference in community health, and I hope that they've served as examples today for those listening about how they might improve community health in their communities. So I want to ask Janae just real quickly, given the time that we're in, with COVID-19 affecting almost every aspect of our daily lives, how has Freeman Health pivoted to provide these essential resources to the community?
I think that since the beginning of the pandemic, we've done what we always do, which is assess the needs of our community and come together to figure out how can we help to fill the gaps in the needs that we have at the time, whether that be testing for COVID, inpatient beds, treatments with monoclonal antibodies, or now vaccinations. We've really stayed nimble in our operations. We've stood up several COVID units. We've expanded them multiple times. We've been there for our community and our nursing staff, met the physical, emotional, mental, spiritual needs of everybody involved. COVID has been a very enlightening process for all of us to learn how we can best meet the needs of not only our patients but our caregivers. We've learned a lot from it, but our hospital has been very proud of our operations and our ability to really look at our community and say, we're here, we're going to do whatever we can to meet the needs, whatever that looks like at that time, and remained flexible and willing to do what it took to be there for everyone.
Wow, Janae, thank you so much. And Paula, thank you so much. On behalf of everyone at the American Hospital Association and those people who are listening today, I just want to say thank you for sharing these ideas for best practices. We wanted to, in the prize, to spread innovation, and you've helped do that today through your generous time. And Paula, I know you said you'd be glad to hear from people who want to learn more about Freeman Health System in Joplin, Missouri. And so feel free to call them if any of these programs sparked an idea in your head about how you might improve care in your communities. So thank you both so much.
Thank you so much. Thank you to the committee, and thank you to American Hospital Association. They are always instrumental in us being able to develop new programs and services. So the guidance and direction we receive from AHA is greatly appreciated. And of course, we're most grateful to the committee for including us in this prestigious honor. Thank you very much.